Dear friends, I am happy to meet you on this Saturday, 15th March 2025. We have finished 1,543 cases of Puberphonia. So we are so happy, so many boys we are treating Puberphonia. So far, you know that I have presented 11 original paper in national and international journal. Now I am writing another article, original article. Our treatment not only changes the voice, but changes the personality of the individual, changes the weight of the individual. We are measuring the weight of the boy when he come and return. So all boys are so happy if they have a good voice. Today, one boy had come, not puberphonic. He want to have a great manly voice. That also we are planning. I met another gentleman. He is a counselor, counseling. He want to have a great voice. That also we are doing. But I have already informed you, Puberphonia, there is 10 character in Puberphonia. So we will able to help them. So today, the great chapter is we want to help the boys, help the Puberphonia. In what way they want the voice, we can change it. How beautiful it is, how great, how they are happy with their new voice. So this gives us more strong, more happy. Every day we are able to help them. So help means they will be happy. They will refer other boys to us. So Puberphonia means don't have that feeling. They will have only female voice. Definitely, you can recognize them with their puberphonic voice or child voice. They will come and they will be worried and then come and report when they feel their voice is female like or child like. That is why puberphonia is recognized. Now we have found there are 10 variants of speech in puberphonia boys. We have formed a separate voice index that is called Kumaresan's pitch index. In puberphonia, 100% all can recognize, all want to eliminate a female voice. But puberphonia boys, they will reluctant to talk with the other individual. That means their voice may be inaudible. They'll talk slowly. They never want to exhibit their voice. We feel they are very ashamed of talking in front of other people. So they were talking inaudible sound, vocal fatigue. when they take more strain and talk, definitely their voice will be so feeble. So vocal fatigue. Mostly the parents will tell they're having the child voice, just continue. But the boys are worried about the female voice. On phone call, unknown people will say on phone call, he's a boy giving a ring. They will recognize other in the other end of the phone call. Are you a lady? When they feel they are having this voice, they try to talk with male voice because 100% they are having the male voice in their phonatory system. With the difficulty, they will be able to talk in the male voice. So it will represent as double voice. But they cannot continue it forever. That is why it becomes tired. And lastly, it will go for nasal voice. But man want a strong voice, but the strong voice is not there. They will have a high-pitched voice. Later it may become hoarse voice and breathy voice. So these are the things we have found out and told the public. So if this is changed, what they will have is a normal voice. Moreover, there's no surgery, no medicine, because there is no alteration in the anatomy, physiology of the respiratory tract, phonatory tract. When the treatment is given by us in the name of Umar, you will have manipulation. So that is the great thing. When they recognize that, அவருக்கு மருந்து கொடுக்கணும் வேற ஒன்றும் இருக்கும் நீங்க கொடுத்துருக்கீங்க. Okay, so they will recognize their voice. So it simply reflects so to us that they are happy with their great voice. They recognized it. That means they will have a normal life. So with this idea, we are changing the life of the boys. That is what a puberphonia boy require. That's what I am telling. Even their weight will increase when we do that treatment. So why this treatment is needed? There is an alarming increase in case of puberphonia. That means boys talking with the female tone and their effect in mental, emotional and physical health. That is why we are able to register 1,543 cases of puberphonia as on today, 15th March 2025. This may give an idea, and many of the ENT surgeons will be surprised to know this Dr. Kumaresan had seen 1,543 cases of puberphonia. They may feel it is a wonder. Even today, we are having 3 cases of puberphonia. Even though today there's no fresh cases, they had come for treatment. Why? Mean since 5 days we are following it. So they will be happy with us for these 5 days, and we are continuing the treatment. Nowadays, I am telling there is a increased cases reporting throughout the world. If ENT surgeons are little more alert, little more interested in taking treatment for giving treatment for puberphonia, all can be treated. They will be mentally, emotionally, and psychologically, they will be all right. But it is not surgery, it is not medicine. So, all the whole idea that it is due to the hormonal that we have changed. Our idea is a novel idea, a small non-invasive procedure. We are changing the voice from laryngeal to pharyngeal. We are utilizing the uvula for getting the low pitch sound. And then we are giving the articulation. Then we are giving the resonance. Definitely it needs good practice in giving a low pitch sound, a good articulation, and good giving a good resonance to the voice. Every day you have to assess the low pitch or high pitch, the strength of the voice, and the strength of the respiratory organ, phonatory apparatus. We have to assess it daily. Then only they will be happy, and it is a good treatment because you have to finish it in 5 days. Because as it is a non-invasive procedure, they cannot go on take leave more than 5 days. That is what our feeling. The objective of our Umar treatment is otorhinolaryngologist, speech therapist. They are treating puberphonia in a good way. But our treatment is non-invasive. So if seriously all ENT surgeon and speech therapists had taken this problem, then we can completely eradicate the puberphonia. Why I am using the word eradication mean? Because the after effect of puberphonia is great. What is the method we are following? Our method following is very simple. Our method following is very simple. Number one, how to diagnose puberphonia? How to diagnose puberphonia means only assess the voice, take the pitch, and confirm the diagnosis. There is no question of blood test or hormone test or any other special test in the neck, finding out the how tension of the neck is there, how the tension of the vocal cord. Nothing will be, everything will be normal. So to say, it is not normal. It is only a hypofunction of the larynx, hypofunction of the vocal tract. If you advise them to do hormone test, what will happen to them? It is not at all relevant to the puberphonia. Without any problem, it occurs. But still, if you want to do hormone test, what will happen? Just think for a while. You want to do hormone test, mean they will be afraid of doing hormone test. They will afraid of taking treatment with doctors because this doctor is telling to do hormone tests. So this will frighten them, and they never want to live with the society. Such a great calamity can happen if hormone test is insisted for treating puberphonia. So one small basic review of uvula manipulation and resonance treat the puberphonia means it is a great. So our expectation is future. We want to discuss with all the otorhinolaryngologists, speech therapists, occupational therapists, and physiotherapists globally. We want to spread the knowledge that it is a easily treatable problem. Why we are not taking interest? So you can diagnose the puberphonia by only hearing. The voice may be inaudible, vocal fatigue, child voice, female voice, double voice, nasal voice, not a strong manly voice, high pitched voice, hoarse voice, or breathy voice. Definitely, they may have the psychological, emotional stress. They may have a problem in speaking. They may have a hoarse voice. All the things are secondary to puberphonia voice. Emotional stress never causes puberphonia. Only puberphonia causes stress. That you have to understand. But all these, it is a functional disorder, it is a mutation disorder. All these we are not accepting. Why means there is no mutation at all. There is no false voice at all. What they are taking is their own true voice. Then another important thing is organic causes also causes puberphonia. No, there is no organ change. There is no laryngeal or pharyngeal organ change in puberphonia. They will have a normal larynx. The vocal cord length will be normal for a male. That's all. So never need not try to change the length of the vocal cord when they are having the normal length of the vocal cord. And another point is, still there is a suggestion in some of the literature, there is a congenital anomaly of the larynx. No, puberphonia, pure puberphonia, there is no congenital abnormality of the larynx. We have seen 3 cases of laryngomalacia with puberphonia. Say they are not able to talk well, so they talk in different manner and low pitch puberphonia voice. Vocal cord asymmetry, vocal structures asymmetry, unilateral vocal cord paralysis, non-fusion of the thyroid lamina, all there are nothing to do with puberphonia. Puberphonia, they will have a normal larynx. That everybody should understand. And it is also more confused that it may be due to the hypogonadism, which is not observed at all in 1,543 cases of puberphonia. So these are the some of the imagination that puberphonia voice can have. How we got this idea of strengthening of the phonatory apparatus? We increase the strength of the uvula, we increase the vibration of the uvula, thereby we increase the vibration of the phonatory apparatus. How we got the idea? Yes, because in puberphonia, I told the structure and function of the vocal cords are normal, but when talking, most of the cases, only edge of the vocal cord vibrate, and there is a gap when adduction of the vocal cord which occurs in speaking. When it is not completely adducted means they will have a puberphonia voice. Why they are not adducting? There is no paralysis, no nerve involvement, no muscle involvement, but the whole phonatory apparatus become lazy. That's all. How snoring happens. All structures will be normal, but the whole structure will become lax. So the similar phenomenon only. It is also found out by previous ENT surgeon that, like Hartman and other people, in laryngectomy, that means in cancer, we used to remove the larynx. Their strength of the tongue is reduced. See, in growth larynx, we are removing the larynx. After removal, they are not speaking at all. So if you measure the strength of the tongue, it is reduced. When you are not using the structure at all, the structure which is performing its function will lose its power. That's all. This is greatly proved by Hartman and other people. Strength of the tongue we can measure easily. So in laryngectomy people, the strength of the tongue, because they are not using, speech is not used properly, the strength of the organ go down. So our duty is only increase the strength of the vocal tract. The phonatory apparatus strength should be increased. That is the proper treatment for puberphonia. That is why we are increasing the strength of the uvula. Thereby, we are getting a strong voice. So it clearly indicates lazy larynx, lazy vocal tract. We have to create a strong voice, mean the tract should be strong enough to deliver the sound. How to increase the strength of your organ mean Newton's law greatly suggests if you increase the weight and vibration, the strength of the organ will increase. If you increase the weight and vibration, the strength of the organ will increase. That is what we are following in humor therapy for puberphonia. That means in uvula, we are increasing the weight by placing a thread and producing more vibration at the uvula. Because we know uvula is also a speech organ. It is not an accessory speech organ. It is one of the major speech organ that we are going to prove it early. So our main focus of puberphonia treatment is redirecting the voice from laryngeal to pharyngeal. Laryngeal sounds are high pitched. Pharyngeal sounds are low pitched. What is the treatment needed for puberphonia? High pitch voice should be changed to low pitch. So what is the option needed for puberphonia? A laryngeal voice should be converted into the pharyngeal voice. That's what we are doing. So all the other subjects, all the other strength, all the other problems of puberphonia will be solved when you treat the voice. That is why we are going on insisting. Puberphonia means it is not only changing the voice, but changing the life of the boy. That is why Assam today, Saturday, 15th March 2025, we are able to treat 1,542 cases of puberphonia. So this is a great achievement and world record, I can say. And we got the certificate for world record also. Soon we will get a new instrument for puberphonia treatment, that is the Umar instrument. Then we can able to attract the whole Puberphonia boys throughout the world and treat them simply. That time, every ENT surgeon in the world may take up this our method of treatment, so we can completely eradicate Puberphonia. Thank you very much. We'll meet next Saturday. Thank you. You great. Happy, happy, happy.